The experts that care for you at Des Moines University Clinic are more than just clinicians. They're researchers, teachers, and mentors who are training tomorrow's healthcare professionals. Call today or visit dmu.edu/clinic.
Hello everyone! We hope you are enjoying the 50 and Better Health Fair. We are the Des Moines University Neurology Club, and we are going to be discussing the importance of sleep for healthy aging. Our topics will include the science of sleep, sleep needs as we age, the benefits of sleep for older individuals, as well as the risks of having a lack of sleep. Finally, we will conclude by discussing the role of sleep in fighting COVID-19 and how you can get a better night's sleep. Enjoy!
Let's look at the science of sleep. There are two types of sleep, non-REM and REM. In general, non-REM has 4 phases that contribute to the recovery of our body as we sleep and the building of our immune system. Regarding our memory, non-REM sleep helps gather our memories in a less organized way. REM sleep is what fine-tunes the unorganized memories and assists us in consolidating our memories. During REM sleep is when we dream, and during this time our voluntary muscles that we actively use every day are paralyzed, so we do not jump out of bed and act out our dreams. Knowing this, you can see why it's important to reach the proper amount of sleep each night. If we lose out on one type of sleep, this could have negative effects on the recovery of our body and of our memory. We also have a rhythm that our bodies operate by. The more normal this rhythm is, the better sleep we will achieve. When it becomes dark out, our brain begins to produce chemicals that start to initiate the process of becoming tired so we can fall asleep at our normal time. There are other chemicals inside our brain that begin to build up as we are awake that also make us more tired to assist us in falling asleep when our bodies need to recover. As we age, our needs are always changing for sleep. It is crucial to get the recommended amount of sleep to perform best, have a positive mood, and prevent illnesses. There is a great book by Matthew Walker who looks at why we sleep and refers to this in very understandable terms on unlocking the power of sleep and dreams and getting the amount of sleep that we need.
We've talked about the basic science of sleep. Now let's talk about how sleep needs change as we age. As we get older, we need less and less sleep. Newborns require 16 to 20 hours of sleep. By the time a person becomes a young adult, he or she generally needs only 7 to 9 hours of sleep. Interestingly enough, seniors also usually need 7 to 9 hours of sleep. Unfortunately, there may be obstacles that prevent seniors from getting the sleep they need. One obstacle is that seniors generally have shorter periods of deep sleep, also known as slow wave sleep. That means that they sleep more lightly and tend to wake up more easily. Another obstacle is the influence of various underlying conditions. These underlying conditions can have a negative effect on sleep quality. 7 out of 10 adults have problems that affect the quality of their sleep. If you suspect that you might not be getting the sleep you need, talk to your primary care provider about whether seeing a sleep specialist would be the right choice for you.
After seeing how our sleep can change as we age, it is important to emphasize that there are many benefits of getting a good night's sleep as we age as well. One of the biggest functions of sleep is to help consolidate our memory. Older adults who regularly get a good night's sleep report improved cognitive function overall, improved memory, and better mental health. This is important for preventing age-related cognitive decline and dementia, as well as playing a role in preventing depression, which is a common mental health disorder among older individuals. There are also some benefits to our bodies as well as our minds. Older adults who report having good sleep at night tend to also be at lower risk for falls, which is a common cause of morbidity and mortality as we age. Additionally, good sleep has been shown to improve overall immune function and reduce risk of hospitalization in older adults. Fewer sick days and hospitalizations means more time doing the things that you enjoy.
Chronic poor sleep affects our body and mind greatly. For example, it can increase the risk of dementia by 33%. It can also increase the risk of heart disease, type 2 diabetes, high blood pressure, obesity, and age our brain 3 to 5 years. Most importantly, it can decrease our immunity, which makes it hard for our body to fight off infections. We also are 3 times more likely to catch a cold. So let's fix our sleep and keep our body healthy.
The risks of poor sleep are now more relevant than ever because of the COVID-19 pandemic. Since the start of the pandemic in the US, there has been a spike in the number of sleep disorders. Some sleep neurologists have described this disturbing phenomenon as COVIDsomnia. What's causing this to happen? Well, based on our current understanding, the main culprits seem to be mental health related: anxiety, depression, loneliness, and chronic stress. And a major challenge is that the problem seems to feed on itself. In other words, it's a vicious cycle. As we become stressed, we lose sleep. As we lose sleep, our immune system gets weaker. As our immune system gets weaker, we become more likely to get sick. And when we're more likely to get sick, we become more stressed. So what can we do to break this cycle and prevent the pandemic from ruining our sleep? We can start by avoiding things that stress us out, like distressing stories on the TV and on social media. We can practice relaxation exercises, try out meditation, and pursue enjoyable hobbies. Lastly, we can try to talk about our emotions and our concerns with a mental health expert who can offer us guidance and support.
Okay, so now after hearing some important information on sleep, it is time to talk about how to get a better night's rest. The first beneficial thing that you can do to get a good night's sleep is to maintain a regular bedtime and wake-up time. Keeping a regular cycle allows you to fall asleep more easily as well as wake up feeling refreshed. Next, try to keep your sleep environment as cool, dark, and quiet as possible. This will improve sleep quality and reduce any distractions that may prevent you from falling asleep or that might wake you up in the middle of the night. Dim and turn off any unnecessary lights 2 hours prior to bed. Also try to remove or turn off any lights from electronics or other devices that you may have in your room. Even the smallest amount of light can prevent you from falling asleep or hinder staying asleep. Try to avoid alcohol or caffeine before bed. It is recommended to not consume caffeine 8 hours prior to bed to avoid restlessness. These 2 things can prevent you from falling asleep as well as affect the mechanisms in your brain that promote a good night's sleep and feeling refreshed in the morning.
The next recommendation for a better night's sleep is to limit daytime naps to 10 to 20 minutes. While napping can increase your overall amount of rest, it can negatively impact your sleep quality at night if overdone. Exercise or being active during the day can promote a healthier mental state and bodily function that ultimately will help you sleep better. If you're still having trouble falling asleep or maintaining a regular sleep schedule, try taking 1 to 2 milligrams of melatonin approximately 2 hours prior to bed. This can trigger systems in your body that tell you it is time for bed. It's important to note, however, though, that melatonin is not a medication to put you to sleep, but rather it promotes the state of tiredness prior to bed. While it would be ambitious to implement all of these tips, even adding 1 or 2 of these could potentially help you get a better night's sleep.
Thank you all for attending our presentation today. Here are some resources we used for preparing our slides. If you have questions or would like to learn more, please contact Des Moines University. Thank you.
At the Des Moines University Clinic Osteopathic Manual Medicine Department, our physicians treat a full range of health conditions according to our different specialties. We integrate osteopathic manipulative medicine into a wide range of backgrounds and trainings, including family medicine, internal medicine, pediatrics, rehabilitation medicine, and neuromusculoskeletal medicine. Osteopathic manual medicine, or OMM, is a hands-on, non-invasive way to assess and treat the structure of the body to improve the function of all systems in the body. DMU's osteopathic physicians assess the structure of the body for twists and turns in the body's framework that can either contribute to or altogether cause your original disease or illness, even injury. These twists and turns are diagnosed and treated by the physician's own hands. Some examples of conditions we treat include adults with chronic illnesses in breathing, digestion, sinus infections, needing help healing after surgery, nerve damage, diseases of the spine, and migraine headaches. We even treat pregnant patients and babies. OMM allows the body to function more efficiently, supporting the ability to fight off disease and more easily recover from illness, injury, or surgery. DMU's clinicians provide thorough consultations to patients to address illness and symptoms that may not be helped by conventional treatment. We invite you to give our clinic a call if you're looking for a physician who can help you get to the root cause of your illness or injury. We're here to help.